Hello, Mrs. Johnson. Oh, hi. It is finally time for me to go home? Yes, it's time. But before I do that, I want to give you a few things that will be very helpful after discharging you. Okay, that sounds good to me. Okay, first is umbilical cord care. Make sure to keep it clean and dry. Make sure to remove the cord clamp when the cord is dry, usually at about 24 hours of age. You can clean the stump with water as long as they allow it to dry afterwards. What should I watch out for? Watch out for some swelling, redness at the base of the stump, drainage with pus, and a foul odor from the stump at each diaper change. The stump will probably fall off somewhere between about 10 to 14 days after birth. Okay, thank you so much. For circumcision care, apply petroleum jelly to the penis for the first 24 hours to keep the diaper from adhering to the circumcision site. Also administer acetaminophen, also known as Tylenol, as needed for pain. Anything I should look out for this specific circumcision care? Observe the penis for bleeding and adequate urination. Cleanse the penis with warm water and apply the diaper loosely. And make sure not to use soap or commercial cleansing wipes until the circumcision has healed, which should take about 5 or 6 days. You may see yellow exudate they may see on the glands after 24 hours and for the next 2 to 3 days, but don't remove it. Why can't I remove it? It's just a normal part of the healing process. Oh, okay, that makes sense. Lastly, I also want to mention for this, if there is a minor bleeding, apply gentle pressure with sterile gauze pad. And if bleeding continues, or if they notice redness, swelling, pus, or a foul odor, they should notify the provider. Great, I will, thanks. In regards to bathing, just give sponge baths periodically until the umbilical cord stump falls off, then you can progress to tub baths. Do I bathe him every day? Good question. Daily bathing is not necessary. It can actually disrupt skin integrity. So when should I bathe my baby? A good time for a bath is when he wakes up, and before feeding. I've left you a pamphlet on the instructions as well on how to properly bathe your baby. Oh, and make sure not to leave them alone at this time. You never know what can happen. Yeah, that's so true. Thank you for the instructions. It looks like it's a lot of steps, but I really appreciate all your help. No problem. So next I'm going to be talking about diaper rash. Bacteria that cause diaper dermatitis thrive in most dark areas. To treat diaper rash, clean the area after each urination and bowel movement. Exposing the buttocks to air helps prevent bacterial growth. Okay, and say he gets a rash, then what would I do? To help heal a rash, apply zinc oxide ointment to protect the skin. Now for nails, just trim when they extend beyond the tip of the skin. Do I trim it with anything special, or do I just use regular nail clippers? You should use manicure scissors or clippers to trim straight across or just file them. The best time to do this is when they are asleep. Is there any special clothing a little infant should wear? So since you already mentioned this, parents should dress the infant for comfort and security. A cap can help minimize heat loss and protect the infant from the sun. Also, a swaddling in a blanket provides secure feeling and helps maintain body temperature. Avoid overdressing the newborn. A general guideline is to dress the newborn as warmly as the parents would dress themselves. Make sure all clothing is flame retardant as well. Okay, that's all great information. You know, Nurse Martha, I'm a first-time parent and I'm kind of nervous about how to keep my precious child safe at home. He's so tiny and fragile. Yes, Mrs. Johnson, it's totally normal to be nervous. I have the pamphlet for you all that shows you all the steps for safety. Thank you so much. Are there anything specific that you would like to mention? Well, they are all important, but some highlights are don't leave children alone, especially on high places or in the tub. Bath water Don't expose child to smoke, and position the infant on their backs to reduce the risk of sudden infant death syndrome, also known as SIDS. Oh, okay, wow, there's so much info. I'll make sure to read every word. I want to make sure my child is as safe as possible. Anything else that I should know? Last thing is we want to make sure you have a car seat and you and your husband know how to use it properly. Yes, Nurse Martha, we have a car seat and read all the instructions. It's a rear-facing car seat, and we know not to place it across the neck or abdomen. Okay, great. Well, you are good to go now. I wish you the best with the new baby. Thank you, Nurse Martha. You are truly great. Of course, have a great day.